The head of the CDC says she, quote, remains hopeful that children under 12 will be able to get the COVID-19 vaccine by the end of the year. It comes as more kids across the country are becoming ill as they head back to school. Anthony Pura reports.
As children across the country continue to return to school, members of the Biden administration urged parents and school staff to take the nationwide COVID surge seriously.
When we implement the masking, the ventilation strategies, the cohorting and the screening strategies, that we can have our kids be safe in school.
CDC Director Rochelle Walensky joined First Lady Jill Biden and Education Secretary Miguel Cardona for a national PTA back-to-class virtual town hall as child COVID-19 hospitalizations reach their highest level in more than a year.
We're seeing outbreaks in places where these mitigation strategies are not occurring.
We need to come together for our students. They need us now more than ever.
Here in Los Angeles, public school students who have to quarantine due to a COVID exposure will soon be able to live stream their classes to minimize any learning disruptions. For the second time since his LA middle school started, Joanna Pacini's 11-year-old son, Juan, is under quarantine.
The concern is that he will fall behind because this is the third week of school.
And in Florida, the state's Department of Education announced earlier this week that it has withheld the monthly salaries of school board members in 2 school districts that made masks mandatory in classrooms. The directive is in violation of an executive order barring local officials from imposing mask mandates. Anthony Pura, CBS News, Los Angeles.
For more on this, I want to bring in Dr. Anand Swaminathan. He's an emergency medicine physician. Good to have you with us, Dr. Swaminathan. As we just heard, the Biden administration and the CDC are urging COVID safety measures for kids in schools. The CDC director also said that vaccines for kids would be made immediately available once authorized by the FDA. How essential is a pediatric vaccine?
Well, the vaccine's a big part of this. You know, there's 50 million kids under the age of 12. Getting a vaccine approved for that group is going to be extremely important in order to protect them. But we have to remember that there are layered mitigation strategies that can help to protect our kids while we're waiting for that. Universal masking indoors, surrounding them with adults and older kids who are vaccinated. The more older kids and adults that are vaccinated, the less at risk our younger kids are. And then schools really need to embrace a testing strategy, testing once or twice a week for everybody in order to detect any issues before they pop up.
And what do you say to parents who wonder if they can trust a pediatric vaccine for COVID-19?
Well, we're waiting for the data to come out, and I think we really need to start messaging now the safety that we see in these vaccines in kids in that 12 to 17 age group, in adults as well, in order to start that messaging early so that when it's approved, we're ready to roll it out to those kids to get as many of them vaccinated as quickly as possible. We are waiting, you know, as scientists, as doctors, we're waiting for that data to come out for us to be able to see it and review it. But it's going to go through the same process, actually a slightly more rigorous process than what we've seen with the vaccines being rolled out for adults and for those other age groups. So we need to wait and see what happens. But this is going to go through a really important process to make sure they are safe. And we're going to have more follow-up data before that EUA than we initially expected. I think that'll help to reassure parents as well.
The CDC researchers are projecting that the U.S. could peak at nearly 6,000 deaths a week. And they also say that cases will not peak until the middle or end of this month. I'm wondering, Dr. Swaminathan, if you can tell us what you're seeing on the front lines right now.
We're seeing some spikes in cases. I will say that unlike a lot of my colleagues in southern states, in Midwestern states and Western states, we're not seeing nearly the same peaks as they are seeing right now. Now, that might be because our vaccination rates are higher. It might be because our mitigation strategies are more robust. In New Jersey, schools have not started back yet, so maybe that's part of the reason we're not seeing as big of surges. But we also have a lot more masking mandates, especially for schools. It's going to be universal whether you're vaccinated or not, and that might help to stem the tide there. But I'm not sure that we can really kind of spike the ball and say that we're starting to see a trend down in Delta, especially with a holiday weekend that's coming up, especially with more kids going back to school. the weather starting to cool in the Northeast, all of these things can lead to spikes in Delta. I don't know that anybody really knows when this is going to peak, when we're going to start seeing falls. We're seeing some signals of that happening. We need to wait and see what data comes out over the next couple of weeks before we can really say that we're ahead of this. But remember, for the last 18 months, we have been surprised every step of the way with COVID's resilience in coming back and leading to more surges. So we really can't celebrate yet. Instead, what we need to be doing is pushing again for more vaccinations and more of those other public health measures that helps to reduce spread.
Well, you mentioned the weather cooling. That's going to mean more people indoors. It also coincides with the potential for the flu season and transmission of influenza. So how are hospitals like yours and across the country preparing for this double influx of COVID-19 and flu patients, especially when some of the symptoms seem to be similar, at least initially?
Absolutely. The symptoms are very similar. It's going to take a big public health push to make sure that people are getting vaccinated for flu. This is going to be the danger of a double pandemic, of having both a huge flu surge along with COVID. That's going to be pretty dangerous. So we need to make sure, again, that we're pushing our patients and letting them know as soon as vaccinations become available for flu, you need to get that as well to protect yourself. Masks are extremely protective against passing flu to others. So if we continue with masking mandates indoors, especially in schools, that can really help to stem the tide. And we saw that last year when we were probably testing for influenza more than we ever have. We saw very few cases. I can tell you that last year was the first year I can remember where I didn't see a single case of influenza. And I think a lot of that is due to the distancing that we've been having and using masks indoors, staying away from people, washing hands, being better about hygiene. All of these things can help to reduce that flu surge that we typically see around this time of year or starting to come in the winter.
Your message on vaccines and the message of so many other concerted people seems to actually be taking hold, because a new Axios poll actually found that opposition to COVID-19 vaccines is decreasing. Still, 1 in 5 Americans remain hesitant. I'm wondering, if these people stay opposed and decide to never get vaccinated, do you believe that we'll be able to get this pandemic under control, or will it become something that we simply learn to live with?
Well, it is great to see rising numbers of people who are planning to get the vaccine or have gotten the vaccine. It really does bring up the matter of what if. What if our messaging from the beginning had been uniform? What if all of our leaders, political leaders, had kind of gotten behind the message that doctors were putting through and saying, everybody needs to be vaccinated, this is a safe vaccine, we need to do this, instead of waiting for a huge surge to spur more people? And probably mandates are a big part of this as well. With FDA approval, there's more mandates being put into place for businesses, and that's going to help to push people forward. And I think actually what we're seeing is that we need more mandates. We need to increase those kind of incentives for people to go ahead and get vaccinated, because we can move that needle. And that's what we're seeing right here, is that those numbers have changed dramatically over time. We need to continue to push those numbers. And if mandates is what helps, then let's add travel mandates. Let's add restaurant mandates. Let's add event mandates. All of these things can help to convince more people that if they want to go back to their normal life, they're going to have to get vaccinated. So we have to work really hard to convince that last 20%. And also remembering that some of that 20% hasn't gotten vaccinated because they're still having access issues. So we need to continue to address those issues as well.
One more question for you. The World Health Organization is warning of another COVID-19 strain known as the Mu variant. The WHO says that it may evade immunity from the vaccine or a previous COVID infection. Explain to our viewers both why the virus continues to mutate and also how concerned are you about Mu?
Well, I think the reason that the virus continues to mutate, this is what viruses do. They will continue to mutate so that they can continue to infect people. As long as there are people who can get infected, this virus will continue to mutate, which really means that we need to be reaching out and getting more people vaccinated, not just in the United States, but getting more of those vaccines to other parts of the world. And, we in the United States are talking about boosters already, while most of the world is still not vaccinated. Still doesn't have a primary vaccine regimen already under their belt. And we need that, not just because we want to protect the world, which we do, but also because we want to protect ourselves against these variants. We don't know much about Mu yet. We don't know if it's really going to evade, if the vaccines aren't going to be as effective. But what we know is that until we make bigger pushes to get more people around the globe vaccinated, these variants will continue to pop up. And eventually, one of them will evade our vaccine. They will render those vaccines either less useful or useless. And that's going to be a huge problem for us to overcome. So unless we push for global vaccination, we can't overcome this pandemic.
Dr. Anand Swaminathan, thank you for joining me, and thank you for all that you do.
Thank you.